Did you know you've got yeast in your mouth? Don't worry, it's normal, but if the bacterial balance in your mouth gets thrown off, it can develop into a sometimes painful yeast infection. And yes, it's the same strain of yeast that causes vaginal infections. Known as thrush or candidiasis, an oral yeast infection is typically the result of an overgrowth of fungal organisms triggered by certain medications such as corticosteroids, antibiotics, and birth control pills. These medications have been known to upset the bacterial balance in the mouth, but it could also be caused by an unbalanced diet or the extended use of hydrogen peroxide-based rinses. Diabetics, cancer, and AIDS patients are also susceptible because of their compromised immune systems. Thrush is very common in infants who haven't developed the full spectrum of oral bacteria, and also in denture wearers, since these bacteria can fester beneath the false teeth. You'll know you have an oral yeast infection if you notice creamy white, slightly raised lesions on your tongue, inner cheeks, roof of the mouth, gums, tonsils, or back of the throat. The tissue beneath the white patches will be red and inflamed if the whitish layer is removed. Swallowing can be painful, and the lesions have a tendency to bleed when scraped by food or irritated while brushing. If left untreated, candidiasis can spread to the esophagus, lungs, liver, and skin. But an antifungal antibiotic combined with better hygiene and diet can usually clear it up in 10 to 14 days. To prevent an oral yeast infection, make sure you're brushing and flossing at least twice a day, avoid rinses that'll throw off the pH balance of your mouth, and try to cut back on sugar and yeast-containing foods, since these encourage candida growth. For more information on how to keep your oral health in shape, check out other videos in this series.